Did you know that just 3 vitamins could change the way your body handles insulin, helping you lower blood sugar and improve your overall health? If you're managing diabetes and feel like your blood sugar keeps out of control, it's time to look at what your body might be missing. These powerful vitamins help your body use insulin better to manage diabetes and keep your blood sugar more stable naturally. Stay until the end to discover the top 3 simple vitamins every diabetic needs to take. Because when blood sugar is stable, everything else starts to fall into place. And I've got some good news for you. If you like and comment on this video, YouTube will get a better idea of what you like to watch and start recommending more videos like this. Now let's start with the first one. Number 1. Vitamin B6. When vitamin B6 levels are low, controlling blood sugar can become increasingly difficult. Vitamin B6 is vital for the proper functioning of enzymes that regulate blood sugar, and without enough of it, insulin sensitivity may decrease. This can worsen insulin resistance, making it harder for the body to manage blood sugar levels effectively. As a result, individuals may struggle to stabilize their blood sugar throughout the day. Without proper blood sugar control, complications such as nerve damage and other long-term issues can arise. Keeping vitamin B6 levels in check plays a crucial role in improving blood sugar regulation. Vitamin B6 plays an essential role in managing diabetes by supporting glucose metabolism. It helps the body break down proteins and carbohydrates, turning them into energy that fuels the body. By improving glucose utilization, B6 helps regulate blood sugar levels, making it easier for individuals with diabetes to manage blood sugar effectively. Without adequate levels of B6, controlling blood sugar can become more difficult, leading to worsened diabetes control. As insulin resistance increases, B6's role in improving insulin sensitivity becomes even more crucial to fighting diabetes. For those managing diabetes, symptoms of vitamin B6 deficiency can be subtle but significant. Fatigue, irritability, and tingling sensations in the extremities are some of the most common signs of a lack of this vitamin. If blood sugar control begins to worsen, it could be an indication that vitamin B6 levels are not optimal. Since managing blood sugar is key to controlling diabetes, recognizing these symptoms early can help prevent further complications. If you are feeling unusually tired or experiencing numbness in your fingers and toes, it may be worth checking your B6 levels. Diabetics are at a higher risk of vitamin B6 deficiency due to several factors. Poor diet, medications, and the body's struggle with insulin resistance can all contribute to lower levels of this vitamin. Since diabetes often leads to issues with nutrient absorption, maintaining adequate B6 intake becomes even more important. Some medications used to manage blood sugar, such as metformin, can also deplete vitamin B6, further complicating diabetes control. Being aware of these causes can help individuals with diabetes take proactive steps to prevent deficiency and ensure optimal blood sugar regulation. Insulin sensitivity is key to managing blood sugar, and vitamin B6 plays a significant role in improving this response. When vitamin B6 levels are sufficient, the body cells respond more effectively to insulin, allowing for better blood sugar control. For people with diabetes or prediabetes, improving insulin sensitivity can be a game changer. It can reduce the amount of insulin needed to regulate blood sugar levels, ultimately leading to better overall diabetes management. By ensuring adequate B6 intake, you can help fight the negative effects of insulin resistance and boost your ability to control blood sugar. Vitamin B6 is also essential for maintaining healthy nerves, and a deficiency can significantly worsen symptoms of diabetic neuropathy. Neuropathy is a common complication of diabetes that affects the nervous system, leading to pain, tingling, and numbness in the hands and feet. Low vitamin B6 levels can exacerbate these issues, making it harder for individuals to manage their blood sugar levels effectively. In fact, managing blood sugar becomes even more challenging when nerve damage is present. Ensuring that vitamin B6 levels are sufficient can help support nerve health and prevent further damage from blood sugar fluctuations. One of the easiest ways to improve blood sugar control is by ensuring that your diet includes foods rich in vitamin B6. Foods like chicken, bananas, potatoes, and fortified cereals are great sources of this important nutrient. By adding these to your meals, you can naturally boost your vitamin B6 intake and support better blood sugar regulation. For instance, a simple snack like a banana can provide you with a healthy dose of vitamin B6 while helping you manage blood sugar. With consistent intake of B6-rich foods, controlling blood sugar levels becomes easier and more effective over time. In some cases, getting enough vitamin B6 from food alone may not be enough, especially for people with diabetes. If blood sugar management becomes more difficult or symptoms of B6 deficiency appear, it might be necessary to consider supplementation. However, it's important to consult a healthcare provider before starting any supplement regimen. They can help determine the right dosage based on individual needs and blood sugar goals. Supplementing with vitamin B6 could be a helpful tool in your overall strategy to control blood sugar and improve insulin sensitivity. It's also important to be aware of how certain medications used to manage blood sugar can interact with vitamin B6 levels. For example, medications like metformin, commonly prescribed to manage blood sugar, can deplete vitamin B6 in the body. This depletion can make it even more difficult to regulate blood sugar and maintain proper insulin sensitivity. If you're taking diabetes medications and struggling with blood sugar control, it might be worth discussing vitamin B6 supplementation with your doctor to help improve your overall diabetes management. To maximize the benefits of vitamin B6 for blood sugar control, it's essential to ensure that your body absorbs it properly. One way to improve absorption is by pairing vitamin B6-rich foods with other nutrients, such as magnesium. Magnesium helps with the absorption of B6, and together, they can support better blood sugar regulation and insulin sensitivity. Consider adding magnesium-rich foods like leafy greens, nuts, and seeds to your diet alongside your B6 sources. By combining these nutrients, you'll be enhancing your body's ability to control blood sugar levels and support overall diabetes management. Number 2. Vitamin C. Vitamin C plays a crucial role in maintaining overall health, especially for those managing blood sugar. It helps strengthen the immune system, which is vital for diabetics who may be more vulnerable to infections. Additionally, vitamin C supports vascular health, which is especially important as high blood sugar levels can cause damage to blood vessels over time. By incorporating sufficient vitamin C into your diet, you can help improve blood sugar control and protect your blood vessels from the damage that can arise from poorly regulated blood sugar. Strengthening your immune system with vitamin C can also make it easier to manage diabetes and fight off illnesses that could complicate blood sugar management. In diabetics, symptoms of vitamin C deficiency can be particularly concerning. If your blood sugar is difficult to control and you're feeling fatigued or experiencing slow wound healing, it may be a sign that you're not getting enough vitamin C. Since vitamin C helps with collagen formation, low levels can make it harder for the body to repair itself. People with diabetes are at a higher risk of infections and poor circulation, and low vitamin C can worsen these problems. If you're struggling with blood sugar control, tiredness, or slow recovery from cuts and bruises, a vitamin C deficiency could be making things worse. People with diabetes are at an increased risk of vitamin C deficiency for a variety of reasons. Poor diet, inflammation, and problems with nutrient absorption can all contribute to low vitamin C levels. Additionally, high blood sugar levels can increase oxidative stress in the body, depleting vitamin C stores more rapidly. When blood sugar is not well regulated, the body's ability to absorb and utilize vitamin C effectively decreases, which can negatively impact blood sugar control. Ensuring that vitamin C intake is maintained is an important part of managing diabetes and stabilizing blood sugar levels. A deficiency in vitamin C can significantly affect blood sugar control, making it harder for individuals with diabetes to manage their levels effectively. Vitamin C is a powerful antioxidant that helps combat oxidative stress, which is often increased in those with diabetes due to high blood sugar. Without sufficient vitamin C, blood sugar levels may become more unstable and inflammation in the body may worsen. This can lead to further difficulties in managing diabetes, as well as increased resistance to insulin. By ensuring adequate vitamin C intake, blood sugar control can improve, reducing inflammation and supporting overall diabetes management. One of the most important roles of vitamin C is its ability to reduce oxidative stress in the body. Diabetics often experience higher levels of oxidative stress due to the damage caused by fluctuating blood sugar levels. Oxidative stress can lead to complications such as cardiovascular disease and kidney problems. Vitamin C helps neutralize free radicals, preventing further damage to cells and tissues. For individuals managing blood sugar, consuming enough vitamin C can help lower the risk of these long-term complications, ensuring better overall health and more effective blood sugar management. Vitamin C is particularly beneficial in preventing common complications associated with diabetes. For instance, it helps protect against cardiovascular disease, a major concern for people with uncontrolled blood sugar levels. It also supports kidney function, reducing the risk of kidney damage, which is another common issue for diabetics. By maintaining proper vitamin C levels, individuals with diabetes can significantly reduce their risk of these complications, ensuring that blood sugar is better controlled and that the body remains in good health. Vitamin C's protective effects on blood vessels help keep circulation healthy, making it a key player in managing diabetes and blood sugar levels. A great way to support blood sugar control naturally is by including more vitamin C-rich foods in your daily meals. Fruits like oranges, kiwis, and strawberries are excellent options. Vegetables such as bell peppers, broccoli, and Brussels sprouts are also packed with vitamin C. These foods don't just help improve insulin sensitivity, they also protect your blood vessels, which are often stressed by high blood sugar levels. If you're trying to control your blood sugar, adding a kiwi to breakfast or bell peppers to lunch can make a real difference. Every bite is a step toward better health and stronger blood sugar regulation. Sometimes, even with a good diet, it might be hard to get enough vitamin C, especially if blood sugar levels are high and causing more oxidative stress. In these cases, supplementation can help. For people managing blood sugar and working to improve insulin sensitivity, vitamin C supplements may support better control. However, it's important not to overdo it. Taking too much can lead to side effects like stomach discomfort. Most older adults do well with 75 to 100 milligrams per day, but always talk to a doctor first. A thoughtful supplement routine can help balance blood sugar and reduce health risks tied to diabetes. To get the most out of your vitamin C intake, it's helpful to pair it with foods rich in bioflavonoids, natural compounds that boost absorption. Citrus fruits, like oranges and grapefruits, contain both vitamin C and bioflavonoids, making them ideal choices for people looking to improve blood sugar control. Another helpful tip is to eat raw or lightly steamed vegetables, since cooking can reduce vitamin C content. By being intentional with food preparation and combinations, you can support blood sugar regulation more effectively. These small changes can lead to big improvements in how your body handles insulin and manages blood sugar levels. For many older adults with diabetes, wound healing can be slow and frustrating, but vitamin C might be the missing link. This vitamin helps the body produce collagen, a protein that plays a key role in repairing skin and tissues. When blood sugar is high, healing becomes harder and the risk of infection increases. By keeping vitamin C levels steady, the body has a better chance of closing wounds faster and avoiding complications. Whether it's a minor cut or a foot ulcer, supporting blood sugar control with vitamin C can make the healing process safer and smoother for people managing diabetes daily. Number 3. Vitamin D. Vitamin D plays a powerful role in how the body responds to insulin, and that directly affects blood sugar control. When vitamin D levels are low, the body struggles to use insulin effectively, which can lead to higher blood sugar levels throughout the day. Think of vitamin D as the key that helps unlock the door for insulin to do its job. With better insulin sensitivity, it becomes easier to manage blood sugar and avoid dangerous spikes. For older adults working to control diabetes, keeping vitamin D at healthy levels can be a game changer in fighting unstable blood sugar. Have you been feeling unusually tired, achy, or even down emotionally? These can be signs of vitamin D deficiency, especially for people with diabetes. Low levels of vitamin D can make it harder to manage blood sugar and may worsen insulin resistance without you even realizing it. When blood sugar isn't steady, the body can feel sluggish and overwhelmed, and even small daily tasks can become draining. If you've noticed blood sugar control slipping, it might be time to check your vitamin D levels. Often, the fix is simple, and the impact on your health can be huge. For many people managing blood sugar daily, vitamin D deficiency happens quietly in the background. Limited sun exposure, obesity, aging skin, and certain medications all make it harder for the body to produce or absorb vitamin D. High blood sugar levels can also interfere with the way vitamin D is processed. This creates a vicious cycle. Low vitamin D makes it harder to control blood sugar, and poor blood sugar control reduces the body's ability to use vitamin D. Breaking this cycle with small changes, like more sunlight or better nutrition, can improve both insulin sensitivity and overall diabetes management. When vitamin D is lacking, blood sugar control becomes much harder. That's because vitamin D helps the pancreas do its job, producing insulin that regulates blood sugar levels. Without enough vitamin D, insulin can't work well, and blood sugar may rise quickly after meals or stay high all day. This can make people feel more tired, more thirsty, and more frustrated with their blood sugar management. If you've been struggling to stabilize blood sugar even with healthy habits, low vitamin D could be the hidden reason. Improving vitamin D levels may lead to more consistent blood sugar and better health. Blood sugar doesn't just affect energy, it affects the bones too. People with diabetes often have weaker bones, and vitamin D is essential to keep them strong. When blood sugar is too high for too long, it can take calcium from the bones, increasing the risk of fractures. Vitamin D helps absorb calcium and maintain bone strength, which is especially important for older adults with diabetes. Strengthening bones also helps with mobility, making it easier to stay active, a key factor in managing blood sugar levels daily. Simple walks outside in the sun can support both bone health and blood sugar balance. Adding vitamin D-rich foods to your plate is a smart way to support better blood sugar regulation. Fatty fish like salmon, tuna, and mackerel are excellent choices. Eggs and fortified foods like milk or cereals can also provide a helpful boost. These foods not only help increase vitamin D levels, but also support insulin sensitivity and improve overall blood sugar stability. If you're looking for a simple breakfast idea, try scrambled eggs with fortified toast. Easy, satisfying, and good for your blood sugar. With the right foods, better blood sugar control can start at the kitchen table. Did you know that just a few minutes in the sun can help your body produce vitamin D? Sunlight activates vitamin D synthesis in the skin, which then helps regulate insulin and manage blood sugar levels. For people with diabetes, this natural source of vitamin D can support better blood sugar control and boost immune health. Spending 15 to 20 minutes outside daily, preferably in the morning sun, can improve how your body uses insulin and stabilizes blood sugar. Safe sun exposure is a simple way to care for your health without medications, especially when paired with a balanced diet. Sometimes, sunlight and food aren't enough, especially for older adults or those with diabetes struggling to control blood sugar. In these cases, a vitamin D supplement can help restore balance and support insulin function. A simple blood test can show if your vitamin D is low, and if it is, your doctor might recommend a safe daily dose. With proper supplementation, many people report better energy, improved blood sugar levels, and stronger overall health. Supporting insulin sensitivity with the right nutrients is one more step toward defeating diabetes and keeping blood sugar under control. If vitamin D stays low for too long, the effects on blood sugar and health can be serious. People with diabetes may experience worsened insulin resistance, higher blood sugar, and a greater risk of complications like nerve damage and heart disease. These problems often develop quietly, but they start with small signs: more blood sugar spikes, fatigue, or weak bones. That's why checking your vitamin D levels and acting early is so important for long-term health. A strong foundation of nutrients can protect you from complications and make managing blood sugar a more confident, peaceful process. Now that you know which vitamins to take to help manage diabetes, you might also be interested in finding out which antioxidants are best for helping to lower blood sugar. Click on the video appearing on your screen. And don't forget to subscribe for more tips like this.